my name's Dr. Annice Mukherjee, and I am a medical specialist, a hospital specialist, specialising in all things to do with hormones. And I've got a particular interest in women's health and menopause. I've got a lot of experience in the work I've done in complex menopause scenarios, including menopause brought on by cancer treatments. And I'm also a breast cancer survivor myself.
Thank you. Could you tell us what is menopause for those that don't know?
So menopause is a description of essentially when your monthly menstrual cycles that you have from after you go through puberty all the way through your fertile life, the monthly menstrual cycles stop. So meno is the sort of the monthly, the cycle, and stop means stop. Pause means stop. So the monthly cycles in women occur after puberty in relation to fertility, in relation to releasing eggs. So the periods and the monthly cycles are all about fertility. And women have a finite number of eggs. You're actually born with a specific number of eggs. And as they're released in your adulthood, you sort of, your stores go down. And essentially menopause is basically synonymous with your eggs running out. So you're no longer fertile. And essentially it's thought that, you have a finite number of years when you can childbear. And then when you get to a certain stage, and it's a different age for every woman, your periods stop, your fertility ends. And you then don't need those levels of hormones going up and down every month. And, for adult women, the monthly cycles are quite exhausting and pregnancy is quite exhausting. So, the menopause is actually a time when you don't have to, your body doesn't have to expend all that energy creating cycles of hormones every month and then having pregnancies. So that's essentially what menopause is. The average age is about 51 in the UK, but it varies in different cultures and different demographics across the world. And most people know menopause, in relation to symptoms. Most people think about hot flushes, but it's quite a lot more than that, really.
Right, thank you. And that comes on nicely to how does it affect us, the menopause?
Well, I suppose the main thing to say is that it's a very individual experience. And it also depends on whether you've had menopause brought on naturally, as in it's just come on its own, a natural menopause. If you've had a chemical menopause or a chemo menopause, so if you've been put into menopause through treatment that you've had, that might be medical treatments or chemotherapy, or sometimes women have a surgical menopause, which is where they have their ovaries and usually the uterus removed. And so how you experience menopause is very individual. It may be impacted by the type of menopause you have and what else is going on in your life at the same time. So there are many menopause symptoms. There's a certain number that are often quoted on if you look online, people say different numbers of symptoms, but because we all experience symptoms differently, I always sort of say I think there's probably an infinite number of symptoms. The commonest are things like hot flushes, foggy brain, aches and pains, insomnia, sometimes a bit of anxiety, mood swings. There's lots of different symptoms, and they're some of the commoner ones, but there's lots of different symptoms that can occur. So the clue that you might be going through menopause symptoms is obviously what else is going on in your life. And if you have had menopause brought on by treatment, many women who get menopause brought on by treatment such as chemotherapy aren't really told that they're going to go into menopause, or they might go into menopause. So it can be still a bit strange getting the symptoms and not knowing what they are. But the other thing that's obviously, most women would be aware of is that if you're having a regular cycle, whether it be every 4 weeks, 6 weeks, every 3 weeks, when you go into that early phase of perimenopause where the hormones are starting to not work properly, your periods can become irregular. And when your periods stop, obviously a woman will have an idea that might be menopause, if depending on what else is going on in her life. But actually 1% of women will have menopause under the age of 40, and 1 in 1,000 women will be under 30 when they go through menopause. And if they've had chemotherapy, they might have an idea, but some women don't actually know they're going through it. if they're much younger, because it won't be on their radar.
Yeah, I didn't know that. Thank you. That was actually really interesting. No idea. I just I just presumed everyone went through it in the 40s or older. So thank you. It's interesting. You touched on this a little bit, but what are the side effects of the menopause?
The symptoms. So the symptoms of the menopause, the hot flushes and night sweats are the ones that most people recognise. And that's because as the estrogen level drops, because estrogen is that female hormone that is linked with the egg release and fertility. Estrogen is sort of present all over the body. So as the estrogen level drops, there's a mechanism in one of the hormone centers in the brain called the hypothalamus that controls temperature regulation. And it sort of goes off target as the estrogen drops down because of some of the other hormones that change during that menopause transition. So the hot sweats, flushes or flashes are the symptom that most women are aware of. And again, they are experienced very differently. Some women will just get a sensation of heat and it's not very bad. And some women will sweat all night or all day, and it can be really debilitating in terms of sleep at night and soaking bed sheets. Or, you know, if you're at work or doing other things during the day, it can be really embarrassing if you're sort of dripping with sweat. So they're the common ones, but aches and pains is a really common one. And it can be general aches and pains, and fatigue, because you often don't sleep as well, and then you're achy and you feel more tired. And the worst symptoms, that all those symptoms can make each other worse. So you can sort of think, oh, I've got no energy, I'm not going to move. So if you don't move, actually aching paradoxically can get worse, not better. And then if you're not moving in the day at all, and you're maybe napping in the day because of tiredness, it can make your sleep worse at night. And then mood swings, irritability, which are often out of character, anxiety. So that's sort of the bad case scenario in a way, of symptoms that can be troublesome. There can be other symptoms like changes in your hair, skin and nails. They can be symptoms down below that many women don't actually want to talk about because it's a sort of taboo subject: dryness, soreness, itching down below, not wanting to be intimate with your partner because of, you know, pain or fear that it's going to be painful. So that there's quite a diverse amount of symptoms. A lot of women notice weight changes, noticing that they're putting weight on their middle a bit more. And again, that can also link with if you're not moving because you're tired and you're napping. So a lot of the symptoms interlink. And a lot of the time women don't realize that tiny little tweaks, I call it micro changes, in how you manage your symptoms just yourself, can actually make quite a big difference. So some women can have really severe symptoms if their instincts tell them, you know, rest, sleep, don't move, and it can make you feel worse. Or, you know, craving sugar and eating lots of carbs can make things worse because it can make you gain weight. But if you kind of counterbalance those sort of thoughts with strategies that can minimize, you know, things getting out of hand, like sleeping in the day, not moving, eating too much sugar. If you balance that, actually the symptoms can be a bit milder. And there's genetics involved in how bad symptoms are. So some women just don't get very bad hot flushes, and some women get them severely. It doesn't matter what they do. So it's just very, very individual. But I think my mantra, and what I talk about a lot, is the fact that I don't like to dwell on the severity of symptoms, because actually, even with the most severe symptoms, there's a lot you can do for yourself. You know, not taking drugs or medications, and there are medications that you can use, but there's lots of things that you can do yourself that can help with those symptoms.
Okay. What are your top tips for helping with symptoms and stuff? I think that would be really interesting to hear.
Yeah. Well, first of all, I mentioned micro changes in sort of lifestyle tweaks. And I think a lot of people roll their eyes up when they hear lifestyle, and they think, oh, like, what's that? I try and eat healthily. I try and, go for a walk. But if you do it very thoughtfully and almost like prescriptively, I talk about giving yourself a prescription for certain things, and you do it every day. It's not just going for a walk once every 6 months, or, having a healthy meal 3 times a week and then not other days. It's about trying to dovetail little healthy habits into your everyday life. And it can make an enormous difference. It can make an absolutely enormous difference, even not just in terms of symptoms, but in terms of new diagnoses of many different diseases. Lifestyle changes are good across the board, and even in terms of cancer diagnoses, they can improve sort of outcomes, they can improve quality of life. So they are really important. So just to say that before I go on to what they are. So I would say probably if I had to give you 3 top tips, because there's lots of different things you can do, but number 1 is to try and move a bit more. And I'm not saying exercise, because, I don't know who's watching this, but if somebody's just gone through cancer treatment or is suffering from aches and pains, it can be tough to get your head around going to the gym or going on a bike or, doing exercise. But actually, it's just simple movement, and it can be just a few extra steps every hour that can make in the working day and during the daytime. I always say, if you're not at work, if you just try and do 250 steps each hour, even if it's around the house, if it's around the garden, if it's around the block, or you can save them up and do a little bit of a longer walk, depending on your energy and how you're feeling and your time limitations. It's not that difficult to get a few extra steps in here and there in the day if you understand the importance of it. And doing about 30 minutes of movement over and above your normal life 5 days a week makes a huge difference over time to health and well-being, to many aspects of your mood, your energy, your sleep quality, your stress levels. And over time, it reduces other conditions like diabetes and depression and a number of different other diseases like high blood pressure and heart disease. So all of those things are good for your health and good for your well-being. And it's just a little bit of extra movement. I'm not saying, go and do loads and loads of exercise, because that's not always logistically possible, and make small changes. So if you're not doing any exercise, just a tiny bit, but if you're already doing some exercise, build on that by tiny increments, tiny changes. So moving is number 1. Number 2, so it's difficult because there's loads of different things, but if I had to say 3, the next one would be thinking about what you eat and reducing the amount of processed and ultra processed foods that you eat. And a lot of people I see say, well, I don't eat processed foods. And then I say, well, all foods that are based on wheat are generally processed. I'm not saying wheat itself is bad, but if you think about it, bread, pasta, cakes, biscuits, pizza, pastry, noodles, they're all very processed, and they can spike your blood sugar when you eat them because they're not whole foods full of fiber. They're generally that you don't have to do a lot of chewing, and then they get into your intestine and go into your bloodstream and spike your blood sugar. And that's not actually, that makes sugar cravings worse because you get peaks and troughs in your blood sugar. And it also causes weight gain, because if your blood sugar spikes, the hormones in the blood that want to keep your blood sugar right, to prevent diabetes, will shunt all of those calories, all of that, carbohydrate, starch that goes into your bloodstream straight into your fat stores. So that's 2 things. It's sort of a well-being and a health factor. And I know that, again, I say make micro changes, because if you're eating a lot of carbs, I'm not saying go cold turkey, because those sorts of approaches generally don't work. Make small changes, reduce the amount of anything that you think might be not good for you. And the other thing is to try and increase the amount of foods that are real food, rainbow food. So things that actually you can see that it grew somewhere. So, fruit and vegetables and things like nuts and seeds and pulses. And there's lots of different real foods available to us today. And it's about finding what you like and bringing that into your diet. So, adding good things and just tweaking and trying to reduce the things that we always see as guilty pleasures. Things like alcohol are actually, full of sugar as well. So limiting that is definitely beneficial to your health, and the spikes in the blood sugar and the weight and all of that as well. So that's number 2. And then number 3 is self-care and stress management. I link those together because we're all under stress. We're all bombarded with stress on social media, in the media. We've all got lots of commitments today, more commitments than ever. Women in general have got so many more roles and responsibilities than women had even 30 years ago. So and the world is more connected, which makes it harder for everyone. So applying self-care, having a little bit of downtime to help with stress management. Stress is toxic for everything to do with your health and well-being, and will make menopause symptoms worse. And managing stress will help. It'll lessen a lot of menopausal symptoms. It's likely to lessen things like hot sweats. It's going to improve your sleep quality. It's going to make you feel less irritable. If you're stressed, you crave sugar, you'll have less sugar cravings. And you don't have to be meditating all day long. You can just have a few minutes downtime here and there, and trying to do something that you enjoy for a few minutes each day, just, you know, for you, not for everyone else, because women tend to look after everyone else before themselves.
Hi, so could you talk a little bit about what the difference is with menopause if it's brought on by treatment, especially for secondary breast cancer patients?
Yeah, so women who have a natural menopause, the average age is 51 in the UK. It can often be preceded by perimenopause, where periods can become irregular, and the symptoms start to develop gradually. But with treatments that induce menopause, there's often menopause comes on a bit quicker, a bit more, I would say, aggressively. So the symptoms can come on quite quickly. So, for example, chemotherapy, the types that cause you to lose your hair, or you have to wear a cold cap to stop your hair from falling out, they're quite toxic to the ovaries, so they can switch off the ovaries. And if you're a young woman going through chemo, it can switch your ovaries off. And then when you're through the treatment a few years later, your ovaries can recover. But if you're closer to your own natural menopause when you go through treatment, or you're already perimenopausal when you're going through treatment, it will generally switch off the ovaries forever. So that will be putting you into a permanent menopause. So chemotherapy can be a temporary menopause or a permanent menopause, and it just depends on the individual. And then other treatments that are sometimes used for women who have breast cancer in particular, but other cancers that are sensitive to estrogen. So estrogen can drive the cancer growth. Women can be given other treatments that aren't chemotherapy, that are hormone blockers, usually by injection, that puts you into what we call chemical menopause. So there's different ways of doing it, and those treatments tend to be more abrupt, and they tend to bring on symptoms almost overnight, quite quickly. And generally, those types of menopause can cause symptoms to be, quite sudden and dramatic and unexpected, and that, it can hit you. It's like anything that's sudden, it can hit you. Whereas if it comes on gradually, your body can get adjusted. Some women who are going through cancer treatment may also have a surgical menopause, which is literally having the ovaries removed. So there's no estrogen production, and that would usually involve the uterus being removed as well. So it would be a total hysterectomy. And again, that's a very sudden menopause. And if you're having chemotherapy or chemical blocking treatment for a cancer that has estrogen receptors, you'd be put into menopause, and it's not then safe to give you hormones back. The whole point is to stop the hormone production. That's how these treatments seem to gain benefit, at least partly, with estrogen receptor positive cancers. So if the symptoms are quite bad, you can't just take the hormones back. It's not as straightforward as blocking and then replacing hormones. It's blocking hormones, and then you have to use other methods to manage those symptoms. And that can be tough, if you're going through a cancer diagnosis, or you're going through other symptoms related to cancer, and then you get menopause symptoms and you can't have hormone treatment safely. It can be quite tough. So, and I think women want to know more about what they can do about those symptoms. And I talked a little bit about lifestyle measures, but there are other treatments that can be used to help ease the symptoms if you are struggling from the symptoms. The symptoms themselves are generally the same symptoms that would happen in natural menopause, but they can just be a bit more florid and rapid when they're related to cancer treatment.
Thank you. What are those other treatments?
Okay, so there's quite a few different options that can be used. I'm, as you've heard me say, I'm a big supporter of lifestyle changes, which can make a difference. But of course, if you're going through a cancer treatment and you're exhausted and it's difficult to implement this lifestyle approaches, or perhaps you're implementing them and the symptoms have come on so suddenly that the lifestyle changes take a bit of time to help. So there are a number of different medical treatments, usually tablets, that are non-hormone related, that can really help. One group of treatment that's commonly used are low-dose antidepressant medications. And a lot of women go, well, but I'm not depressed, I'm going through a hormone, change through cancer treatment. It's not depression. But actually, some of the antidepressants in very, very low doses have been trialed over many, many years in women going through breast cancer. And in very low doses that aren't even significant antidepressant doses, they relieve sleep, they help with sleep quality, they reduce sweating, and they help with mood. And those three symptoms are really important menopausal symptoms. So if you get rid of those three symptoms, a lot of the other symptoms are then manageable. So those treatments are really worth a try if you're really struggling with those menopause symptoms. And not everyone will struggle with those symptoms, but some women will struggle more than others. You don't know who you are until it happens to you, sort of thing. So there's a medication called Venlafaxine. There's another medication called citalopram. There are a number of medications. Most of those will be the antidepressant groups that are used for menopause symptoms. Some can't be used because they can interfere with other medications you might be given, such as tamoxifen, if a woman's being given a drug called tamoxifen, which is a selective estrogen blocker. So it's obviously a discussion that you should have with your cancer team, but some of these, certainly venlafaxine, can be given with other menopause treatments and be very effective and safe for menopause symptoms. Beyond that, there are other medications that can be really helpful if you've got a lot of sweating and you've got bladder difficulties, because if you have vaginal symptoms and you have maybe needing to go to the loo a lot and you're waking up at night to go to pass urine a lot, there's a medication called Oxybutynin that can be really helpful for your bladder and also for sweating. So it depends on what your symptoms are, your main symptoms. If you've got low mood and insomnia and sweats, then the antidepressant type medication is better. There is a medication called clonidine, which I sometimes use in my patients which it's actually a blood pressure medication, but it is brilliant for sweating, and it tends to help with sleep because it can make you feel a little bit sleepy. So if you have very low blood pressure, it wouldn't be suitable because it might make you feel dizzy, it might drop your blood pressure. But if you have high blood pressure and you're sweating and you're going through these symptoms, it's a really good option because it would actually lower your blood pressure. And high blood pressure is bad, and it can cause health problems. So clonidine is another medication. So it depends on what your main symptoms are, and your team can discuss management with you. For vaginal symptoms, there are a lot of non-hormone lubricants and moisturizers that can be used to ease the itching, soreness, dryness down below, which is a symptom that a lot of women don't want to talk about, but actually that can sometimes be the worst symptom. And cancer teams will sometimes feel that it's okay for women going through cancer treatment, even if it's estrogen positive cancer, to have a course of vaginal estrogen, because that only goes into the vagina. It doesn't go through the whole body, so it isn't increasing the risk of the breast cancer cells spreading or thriving through being given the fuel of estrogen, because it's only in the vagina, and that can help with symptoms. So that's something that would be discussed with your cancer team. And those treatments, along with doing sort of changes in your, having good sleep patterns, stress management, moving, attending to your diet, with hot sweats, there's lots of lifestyle things that you can do, avoiding hot and spicy food, wearing layers of clothing. There's lots of small tweaks that actually you can do that will reduce the severity of the symptoms. So I tend to say dovetail treatments together, use things that you can do for yourself with medications if needed as well.
Thank you. That was really interesting. I myself have learned lots, I have to say. So thank you very much. Do you think there's anything else we need to cover that I need to... I can dovetail it into this.
Let me just see what Claire wrote.
I think we've covered everything that I got from that Claire sent to me.
How it affects the side effects. little bit about menopause brought on by breast cancer treatment. Oh, okay. So we've done those.
Yeah, it was just to make sure there's nothing else you felt that was important for ladies to know.
Yeah. Let me just have a think. I mean, it's not safe to take hormones. I don't know whether it's worth just saying, because I think I've touched on it, haven't I? The fact that it's not safe to take hormones if you've got estrogen.
Yeah.
I think probably not. I don't know. I think that's probably
enough.
Yeah, I've talked about.
And then you've got the Instagram Live if anybody's got particular questions that they are unsure about.
Just trying to think if there's. Normally we can talk for hours. Menopause. Yeah, no, you have covered it all really. I think it's probably okay.
Okay. Well, I'll maybe when Claire's back, I'm hoping she'll be back. You know, maybe get her to watch it in case there's something that really jumps out to her, and maybe then she can catch up with you, even if you've got 5 minutes somewhere, just or if there's something she feels like there's one question that's really obvious we've not asked.
We didn't talk about bone health. Oh, I suppose because it's not so. And we didn't talk about tamoxifen and aromatase inhibitors and the side effects, but because a lot of people will be on either tamoxifen or aromatase. You might want to just ask that. Would you ask that? Just, I've mentioned tamoxifen and other medical treatments for menopause. What side effects do they cause?
What side effects does the secondary breast cancer treatment cause?
Yeah, so tamoxifen and aromatase, and have you heard of those two? If you say, you mentioned the additional treatments for breast cancer like tamoxifen, do they have side effects?
Right. Okay. So
do you want to ask it or yeah?
Yeah, right. I'll just do a wee pause, I'll ask it, and then Jack will be able to like cut it all together. He's gonna love me when he gets this. So you mentioned some of the additional treatments for secondary breast cancer patients, and how do they affect the menopause?
So additional treatments that can be used, as well as things like chemotherapy, the hormone selective hormone receptor blockers such as tamoxifen and aromatase inhibitors are often given to women who've had estrogen receptor positive breast cancer. And they will cause different side effects in different people. Tamoxifen is often described as causing menopausal symptoms, and that's often in women who are, having menopause induced by chemotherapy at the same time. And so tamoxifen, for some women, will give menopause type symptoms, and for some women, it gives no symptoms or side effects at all. And tamoxifen is a selective estrogen receptor blocker. So it blocks estrogen in cancer cells, breast cancer cells, but it can stimulate estrogen in some other areas. So in bone and in the vagina, tamoxifen stimulates estrogen. So a beneficial effect of tamoxifen in many women will be the opposite of dry vagina. It'll be, sort of strengthening of vaginal secretions, which can be sort of a beneficial side effect. And tamoxifen it doesn't affect bone health negatively. It actually strengthens bones, particularly in postmenopausal or women who are older. So tamoxifen can have some side effects, which are generally just like menopause, but it can have some beneficial effects as well. The aromatase inhibitors are used usually in women who are postmenopausal, so they've already gone through menopause, they've been there, done that before their treatment. And aromatase inhibitors block any estrogen production from anywhere in your body. Like we produce estrogen from fat cells, so it will block estrogen in any cells in the body, including cancer cells. Aromatase inhibitors tend to cause slightly more in the way of side effects, in that they can cause aches and pains and tiredness, and the aromatase inhibitors can thin the bones as well. So most women who are given aromatase inhibitors, so Arimidex, there's a few different types of medication. You would generally be given a bone density scan to look at your bone health before you start that treatment. And the doctors giving you that treatment might want to just make sure you protect your bones. Sometimes they'll recommend extra vitamin D and calcium. So those treatments, again, if somebody gets side effects from those treatments, it's really important to tell your cancer team and talk about what the side effects are and to see what can be done, and if the treatment perhaps needs to be tweaked or changed, because those treatments are really helpful as part of treatment, and so if you are struggling, it's just share that information with your team. It's like with any of the menopausal symptoms, the cancer teams are absolutely brilliant in terms of the treatment they produce, but they're so busy trying to deal with cancer, they often forget about menopause. And so if you're getting symptoms, it's just really important to share with them. They'll want to help you.
Brilliant. Thank you very much.
Okay, my pleasure.
Great. I think that's us then, isn't it?
Okay, yeah, that's great. Yeah, I think that's covered everything. So, and then we've got the live, so people can watch it and yeah, take it from there.
Brilliant. And I'll get Claire to get back in touch once she...
Oh, I hope she's, send her my regards. I hope she's okay. Yeah.
Yeah. I'll pass on the message. Thank you very much.
Nice to talk to you. Hope it works when you cut and paste.
Yeah, I'm hoping I can get this recording because I've done one on my laptop and one on the cloud because I thought it was safer. So hopefully that'll be fine.
Hopefully. Okay. All right. Nice to see you.
Thank you so much for your time. Thank you.
Bye.
Bye.